Hi, this is Mark Ittleman, Speech Language Pathologist, and welcome to the teaching of talking. You're probably here because you might have an interest in aphasia, or you might have a loved one who has aphasia, or you might even be a speech therapist who's looking for answers and ways to help people speak. And if you're a person with a loved one with aphasia, you've probably been through quite a bit of experience. Well, I've been with you at the rehab hospitals and at the acute care facilities when patients are brought in with a stroke and they wake up the next morning and they're not talking, and it's a big shock to the family. The family's coming into the room and finding out that the person's had a stroke and they can't talk. Oh my goodness, it's amazing. And then the caregiver has to go through all these ordeals and all the paperwork and wondering if their loved one is even going to live. Or what's going to happen? Maybe they have paralysis on one side of the body and they have difficulty moving a part of the body, or they've lost their ability to speak. And so they're shocked. Everybody's shocked. The person with aphasia or the speaking difficulty is shocked. The family is shocked. And it's a very, very, very trying time. Now, those with aphasia or speech difficulties as a result of stroke usually have an aphasia. And aphasia is a loss of language. And that happens with language comprehension. They have difficulty understanding what's being said to them. Not all of them, but many do. Many lose the ability to read and comprehend language through reading. And then there's the ability of expressive language, where people with aphasia have difficulty talking. They have difficulty writing. They just have difficulty expressing themselves. And there are things that they want immediately, and things that they want to tell a loved one, but if they're in a hospital room or they're in an acute care center and they can't talk, it's extremely traumatic. And so then they go through the process of therapy. Now, after that, they go home, or they go on to another facility and get more therapy. But the problem for many is that the quality of the therapy may not be to the family's liking or to the patient's liking. Often there are inexperienced therapists or therapists that are using outmoded, antiquated methods to help a person talk. And quite often they're not even helping people talk. They're dealing with handout sheets, cognitive drills, reading or writing skills, or they're working with naming the days of the week or the months of the year. That's okay, but that's not talking. And what is so important is that the caregiver learn methods right away, right out of the starting blocks, even at the rehab hospital. That's what I did working at some of the major rehab hospitals in the country. As soon as that person gets in there, as soon as the person is hospitalized, and as soon as they can start speech therapy, I work with the family and require that the family is there so I can start teaching them exactly what to do. I mean, after all, when the patient goes home, they're there 12, 18, 24 hours a day. What better place is there to relearn or get better at talking? And who else would be better than a wife or a husband or a family member who really loves that person with aphasia and wants to see them well, wants to see them talking again? And so that's what this is all about. It's about empowering you, empowering caregivers or family members whose loved ones may not even want to go back to therapy again, because quite often it's frustrating, it's hard, and the person sometimes is given, these elementary exercises, like I had one woman who said, they were trying to get my husband to say toothbrush and he has no teeth. And they were trying to get him to say hairbrush and he has no hair. Well, a caregiver knows the language that a person with aphasia has. A person can anticipate the needs of an individual with aphasia. What person would be better than a loved one at home stimulating speech and language around the clock? That's what the teaching of talking is all about. Hi, my name is Mark Ittleman, speech language pathologist. I've been a speech pathologist for going on 46 years now, and I still have a deep love and passion for care partners and individuals with aphasia, and I'll tell you why. Because I've spent my life dedicated to aphasia. I've written books. I've lectured all over the world. I've helped people all over the world, no matter what language they speak. I have a burning desire in my heart to help you. And that's why we developed, I wrote a book called The Teaching of Talking. It's developed just for the care partner, so that you can learn exactly what to do. But what we find is that sometimes a book doesn't always deal with exactly what the individual is displaying at the moment. And so then I developed an audible.com audiobook on the teaching of talking. And then I developed a video program for those who want to help their loved ones speak better. But I'm doing something totally different in Teaching of Talking 2.0. I know that people do 1,000% better with me at their side, teaching them exactly what to do, showing them the rhythm, the speed, how to emphasize words, how to mirror, how to do so many methods that only a speech pathologist with over 40 years of experience knows how to do. And I teach you exactly what I know so that you can become just as good as I can at stimulating speech and language. You can become as good as any therapist out there. And you don't have to go to an intensive program and get on an airplane and go, hundreds of miles away or thousands of miles away and thousands of miles and thousands of dollars to have your loved one worked with for a number of days. And then you go home. And we all know that we all forget. But, people with aphasia forget even more. Okay, so quite often, whatever is learned can be very easily forgotten unless there is a care partner who knows exactly what to do. And that's what the Teaching of Talking 2.0 is all about. Now, we have 2 visits a week for most people. Why is that? 1, we teach you with your loved one how to stimulate speech and language. I'll show you. It's easy. And then on the other visit per week, we call that the skull session. And the skull session is working on the mental side of the game. The mental side of the game is critical. The mental side of the game deals with beliefs. And a lot of people with aphasia, if they haven't had good experiences with therapy, guess what? They don't want to do it anymore. So they've got a fixed belief. No, I don't want to do it. It's too frustrating. I just don't want to. Or the family doesn't know what to do, and they're trying to get the person to talk, and they don't know what to do, and they just end up bugging the bejeepers out of the person with aphasia until after a while they just say, no, I don't want to do this anymore. So in the skull sessions, what we work on is changing the belief of the individual. Many believe, they've heard doctors say, you're never going to talk again. They've heard therapists say, well, I think he's plateaued. They've heard all of this. And you know, when we hear things that people say about us, it resonates in our minds, and we think about it. And we think about it over and over and over again. And you know something? Anything that we think about over and over and over again becomes a fixed belief. And if you have a fixed belief about something, your behavior is going to reflect. Your thoughts are going to reflect that belief, and your behavior is going to reflect that belief. So many caregivers believe, well, I guess there's no way to treat this. I guess I'm going to have to get one of those talking computers or something. Well, that's not necessarily true at all. If you want to find the best way to help a person speak better, work with an expert who is specialized in aphasia, an expert who has the experience over 45 years of helping people speak again. So, that's who I am. That's what the Teaching of Talking 2.0 is about. If you're interested in working with me, send me an email at talkwithmark. That's all one word, talk, TALKWITHMARK, 1, that's the number 1, at gmail.com. Yeah, send me a email and tell me if you'd like to find out how to work with me. Now, Teaching of Talking 2.0, it's an individual one-on-one program. And I work with people, each person, twice a week. Now, there's only a certain number of people I can work with. And I'm already just about half booked now. So if this is something that you want to do, I would encourage you to send me an email and fill out the box for information. Tell me your name, your email address, your phone number, so that we can have that on record. We'll be sending you lots of information anyway, whether you sign up with me or not. But this is an opportunity of a lifetime. I'm not going to be doing this forever, okay? You all know that. And you know that you're not going to be doing it forever either. So let's take advantage of the time we have and contact me today at talkwithmark1@gmail.com and let me know that you'd like to have a conversation with me. We'll send you a little questionnaire with some questions in it that we'll ask you to fill out. And then when you send it back to us, if we think it's a good fit, then I'll call you. And we'll have a get acquainted free session on the phone where I'll find out what's going on with your loved one who's got a speaking difficulty. So I want to say goodbye now. Remember, time's a-wasting. This is Mark Ittleman, Speech Language Pathologist, and wishing you a great day. And let's get in touch, okay? Bye-bye now.